Ambulances are making emergency runs, or are they? Sometimes ambulances are used for non-emergency trips to hospitals, doctors, and clinics, and that's okay under certain circumstances. But as Channel 2's Mike Taibbi tells us in a special follow-up report, Medicare is now questioning whether ambulances are providing legitimate medical care or just very expensive rides.
Last February, Channel 2 reported that the American Ambulance Company of Brooklyn was billing Medicare more than $500 apiece to transport kidney dialysis patients to and from the Richmond Kidney Center in Staten Island, even though it was not medically necessary for those patients to be transported by ambulance. One patient's daughter confirmed that her mother was simply getting the most expensive cab ride in town 3 times a week.
She didn't need oxygen, she didn't need any special care to get into the van. All she needed was a ride.
The federal Medicare program, which pays the bill for those ambulance runs with your tax dollars, had already begun an internal review of the general problem.
And then Channel 2 did something that's right on another ambulance company.
Our story accelerated the review. The result, an audit of 18 New York-based ambulance companies, which tentatively concludes that over a 3-year period, there have been overpayments to those companies that today total some $109 million. $109 million worth of trips that Medicare says lacked medical necessity to substantiate the need for the reported ambulance service.
They are saying that these patients are denied because the patients walked. Nowhere does it say the patient walked.
Stephen Zackheim runs the Metropolitan Ambulance Company, which was hit by Medicare with the biggest tentative overpayment claim, more than $22 million. Zackheim says he knows the industry is filled with slimy operators, his words, but that he has the records to prove that Metropolitan is not one of them.
I know that we are going to justify every single transport, and our number is going to be reduced to 0, not to $1 million, not to $10,000. I believe our number is going to be reduced to 0 because I checked it, our staff checked it.
But former Metropolitan drivers whom Zackheim says he fired tell us they routinely and on supervisors' orders transported patients who did not need ambulances. They said that often 2 or 3 patients at a time were transported by ambulance with a separate form filled out for each patient, as long as each patient had a Medicare card.
In the business, a lot of people call it the gold card. If you got the gold card, you can do anything. You can go anywhere.
If you have the coverage to ride an ambulance, you will be given the ambulance. Not because it's necessary, because I can bill for it.
I felt like a cab driver, basically.
The driver said everyone knew the rules, that Medicare will pay for non-emergency ambulance transport only under certain conditions. For example, if the patient has a major fracture or is in a body cast, is bed confined, immobile, disoriented, in extreme pain, or must be moved by stretcher. But they described as routine throughout the industry, what we saw later on our own. For example, this Medicare patient who'd been transported from a nursing home in another company's ambulance, walking around Brooklyn Hospital for the better part of an hour. Zackheim says the drivers are lying and trying to destroy his company.
And once again, once we find one of these individuals that do these things, we immediately dismiss them from our employ.
It's hard to square the numbers we're talking about when you look at some of these operations. This is the American Ambulance Company in Sunset Park, Brooklyn. The tentative overcharges over a 4-year period involving thousands and thousands of trips deemed to be medically unnecessary, over $14 million. Owner Ed Weiss only spoke to us off camera, but he said, look, we're a transport company, one that's going out of business, by the way, and if the doctor says the patient needs an ambulance, we're not going to say no, the patient doesn't need one. End of statement, or no statement, we were told, at one company after another.
I'd really have to refer you to the Ambulance Association for any information.
No one would answer our questions at Dell and Metro One, 2 companies operating out of the same Brooklyn garage that have been hit with a combined $15 million in tentative overpayments. But if our questions were unwelcome wherever we went, and they surely were,
get off the premises or I'll call the cops.
They're going to have to be answered for the auditors at Medicare, and apparently some of the ambulance companies know it. Recent billings for ambulance runs have decreased nearly 30% over a comparable period last year.
I'm sure that they have gotten the message. I think it's been quite clear that there's a focus on this type of billing.
If it is clear, the private ambulance companies aren't telling the taxpayers who foot the bill. And they've only told us they will fight Medicare, even consider suing Medicare, to keep the millions they say they've legitimately been paid. Medicare admits that healthcare providers, including doctors, sometimes request ambulances for expediency or for the comfort of the patient. But Medicare says that does not relieve the ambulance companies of the responsibility for only submitting claims for ambulance trips that are medically necessary. Medicare hopes to make a final determination of the amount of the overpayments by the end of the year. Mike Taibbi, Channel 2 News.